Greetings. It's great to be with you today. I am super excited to be bringing you this Facebook Live with the Philippine Nurses Association of America. And I'm especially excited to be here with my dear friend, Virginia Alinsao. And she is the chair of International Affairs for the Philippine Nurses Association. And I'm also here with a new friend, Melissa Cunanan. And Melissa is the membership chairperson for the Philippine Nurses Association, as well as the assistant treasurer. So welcome, ladies. It's great to be here with you. So let's start with you, Virginia. Can you share a little bit about yourself, Virginia, and your background?
Okay, sure. I'm from Iloilo. I graduated from St. Paul's in Iloilo. So I lived in Iloilo all my life. So went to high school at UP High School, St. Paul's, and then I immigrated to the US soon after graduation, and worked in academic medical centers all my career while in the US. I started at Hahnemann in Philadelphia. That was my first year experience, and that was an exciting time, challenging time. And then I moved to University of Virginia in Charlottesville, a completely different place, and an academic school, Ivy League school. And then from there, I moved to Baltimore to work at Hopkins, where I stayed for 32 years and retired from there. So my role has been, I work as a staff nurse. I've been a nursing supervisor. I've been a director of nursing. I've been a hospital administrator, and also an administrator for Hopkins International Patient Services, and did the recruitment of Filipino nurses in the early 2000s. That was when we started doing recruitment of nurses from the Philippines, and we brought about 300 nurses from 5 different countries, but predominantly from the Philippines. So I'm very familiar with the all the onboarding and the challenges that we Filipino nurses encounter in the immigrating to the US. So I'm very pleased to be able to share that experience with all of you. And I am, I now actively participate with the Philippine Nurses Association of America in the Office of International Affairs. And our goal here is to have more of a global reach, because we Filipino nurses are all over the world. So we wanted to be able to encompass a lot of not just the US nurses, but nurses from other parts of the world. So that's my brief intro. Thank you.
And Virginia, I think we met in the early 2000s when I was working with Johns Hopkins. And we go way back. Yes, and I think you bring such a great, unique, but broad perspective. So I'm really excited to hear more. Melissa, let's go to you. Can you tell us a little bit about yourself as well?
Good morning, everyone. Magandang umaga to all the viewers in the Philippines. So anyway, I'm Melissa Cunanan. I'm a neuro-ICU nurse at UT Southwestern Medical Center here in Dallas. And I've been at the bedside for 31 years now. I'm a graduate of the UP College of Nursing in Manila, and I've worked in the ICU all my life, from my first work in Makati Medical Center at the CVICU, and then I was recruited as part of the 39 nurses in Abilene, Texas back in '94, and I have worked in UCLA as well, at the CVICU as well. And like I've mentioned, I'm currently a neuro-ICU at UT Southwestern. And I have 3 boys. And I'm also married to a nurse, a bone marrow transplant nurse, and a UST grad. Mm-hmm. And I also hail from the same area as Tita Virginia is from, but I'm from Bacolod, but grew up in Manila. I was born in Bacolod. Thank you.
Great.
And I'm the membership.
Well,
thank you.
Well, welcome. So, maybe one of the things that would really be of interest to all of those viewing this today is what was one of the biggest challenges that you faced, and what do you think that is more globally for Filipino nurses coming to the U.S.?
I'd like to take that question. I think one of the critical elements of this is the communication. And we always pride ourselves in the Philippines that we speak English. Our curriculum is taught in English. And then you come to America and then you start talking to your colleagues, and then half of the time they don't understand what you're talking about. So because they talk too fast and you're trying to do like a proper English conversation, and then they would say like, what the hell are they talking about? It's because they use idioms or slang or whatever, especially in what part of the country you happen to be. So I always laugh because I always tell people, if you don't understand, ask them to say it again. And they said, yeah, but they look at you and they said, like, are you dumb that didn't you understand what I was saying? But that's okay. It takes practice to do that. I think that's probably one of the challenges that we encounter. Even to this day, they owe my American staff, when I was working as the director of nursing, they always make fun of me when I do a staff meeting and they look at me and they said, were you with your Filipino friends again this weekend? Because you're not making sense, So they said, you're talking in English, but half of the time I don't understand what you're talking about. So then I realized that when I do a direct translation in Ilonggo into English, it doesn't flow, So then that's when I have to make a conscious effort to make sure that I am thinking and I'm processing the information in English, because it does not, translating it from your dialect to English, sometimes it doesn't make sense. So communication is important. So that's why I always encourage people. I said, watch the American television, read the newspaper, because that's one way for you to get acquainted with the language, with the syntax, and all of those things. So I think communication, it takes practice. I mean, it takes practice. We Filipinos, the other thing that they make fun of me is sometimes our he and she are, we don't have a pronoun for men and women. So sometimes they say, here she goes again. She talks about Joe, and by the end of her sentence, it becomes a Josefina. So because we do the he and she interchangeably. So, but when you're working with colleagues for a long time, after a while they figured out what you were trying to say. But be conscious of that, But read and watch American television. That's one way to get exposed to it, which I'm sure the Filipino nurses are more familiar with that now. Whereas in my era, that was not really available.
I would just add to that, that one of the things we do at Avant is we go out to our clients in the hospitals and help prepare them for that part of the transition. In America, we think, okay, there's only one version of English. And there's really 18 versions of English in the world. And then, Virginia, as you pointed out, we've got all these colloquialisms and, slang terms, and it varies depending. I'm sure it was very different in Philadelphia than in Virginia. And so whatever part of the country you go to, there'll be differences. So that is a great point. And like I said, we really try to help the clients have an appreciation for different versions of English. And, during stressful times, that those translation skills that you mentioned can be delayed. And what's more stressful than coming into a new country and being in a new professional environment and having so much come at you? So, great point. Melissa, what would you say was a big challenge?
Well, as a Filipina, I have often felt like I need to work harder than most of nurses like me. But I have so much to be grateful for. But the specific challenges I have with my career is, I agree with Tita Virginia that language and was a part of it. I was in I'm still in Texas, but I was recruited to Abilene, Texas, and the Texan and Southern accent is so strong that it's very hard to understand. And there's a lot of idiomatic expressions that sometimes I'm like, what did they say? So you have to adapt to it. But I was lucky that our recruiter and our human resources in our local hospital in Abilene gave us a 3-month accostumation course, and that included language and how to pronounce medical terms, antibiotics, because it's pronounced differently back home. And another thing is the new hospital environment, just adapting to computer charting, talking with the doctors, answering the phone. I remember on our first few months, we would all pretend we're busy because we didn't want to answer the phone because we were afraid that we won't understand we won't understand the doctor on the other line and we will get the wrong order. So it was funny. We were all like, would go to our rooms or pretend we didn't hear the phone. And, those are some of the challenges. And then another thing is the challenge of self-care at the time, because in a few months, you'll start missing your family. And at the time, during my time, international calls were really expensive. It was $1 per minute. I mean, luckily nowadays, the new nurses are very lucky with the advent of social media and all these applications like the Viber and the Facebook and Messenger. They're able to communicate with their loved ones across across the country in just a matter of seconds. And another challenge is just having. We were lucky though that we had the local Filipino community support, and to all the new Filipino nurses, reach out to your local community, to your local Philam community. They'll be more than willing to help you. They will be your new ate, kuyas, titas, titos, and they are all willing to help. Thank you.
Yeah. Well, thank you. All are really good points. And I always tell every new group of nurses that come in here to our transitions program, how a huge transition that you undergo coming to a new country and dealing with all of those changes. Virginia, as you mentioned earlier, Filipino nurses are making an impact on patient care all over the world. What are you most proud of as a Filipino nurse?
Okay. Every time I travel, wherever I go, I think a lot of that, it's that we basically educate and train nurses to be adaptable and to be the caregivers in the world. If you come to the Philippine Nurses Association website, the other thing that I'm so proud of is that you will see an impressive group of Filipino nurses who are in research. I mean, a lot of PhD or doctorate level nurses. So if, as you can see, the opportunities are there. Are here in the U.S. to be able to advance yourself professionally. So you see a lot of Filipino nurses in the major medical centers, and then so academically you can see them in academe, in the hospital setting, the health system as a level, and I think that is one piece that I'm most proud of, because we're making an impact on the healthcare system. And many a times you would hear comments from patients that say, "Oh, we love the Filipino nurses because they are kind, they are good, they're competent." So and many a times I think that is the very reason why the Filipino nurses are the we capture a lot of the the market, I guess, in the world. It's just because we have the quality people as Filipinos.
Melissa, what would you say you're most proud of as a Filipino nurse?
I agree with Tita Virginia. But as a Filipino nurse, I can proudly say that Filipino nurses are dedicated, compassionate, and hardworking. I've been working at the bedside for 31 years, and I can truly say that a lot of my Filipino coworkers fit this description that I gave, and they are truly the best nurses in the world. You go to a hospital, and there's always definitely one Filipino nurse in there working. And another thing that I'm proud of, just like Tita Virginia, is our organization, the PNA of America, which is a professional nursing organization with over 55 chapters all over the US, and whose mission is to uphold the positive image of the Filipino American nurses through education, research, and professional excellence.
I would just echo what both of you said about the compassion and the caring of Filipino nurses. I had the unfortunate experience of going through 8 months of chemotherapy with my daughter, and we had 60 inpatient nights. And by the end of that, the nurse manager would let me call and tell her we're coming. And the nurses that I requested, she allowed us to request our nurses. After 8 months, we felt like we lived there. But there were some very, very special Filipino nurses that made a really big impact on my daughter's care, especially at that time, after being so true. That has been especially hard. Again, the transition to the US or to any country, is very difficult. I mean, it's just on so many levels. But we have just gone through this pandemic. And, the uncertainty, the unrest for all of us everywhere in the world has just increased dramatically. And Melissa, one of the things you said earlier was about self-care. The American Association of International Healthcare Recruitment did a survey, and we surveyed the members' nurses. So that was primarily international nurses. And over 75% of the respondents said that they had felt extreme stress, anxiety, and burnout during the pandemic. And so, can you talk a little bit more about how PNAA may be supporting the nurses, helping them with prioritize self-care? Because Filipino nurses are all about taking care of everyone else. And so can you speak to that?
Yes. I can't really compare the COVID-19 with any other healthcare calamities that we've experienced. And it is the worst and most challenging experience we've all probably had, especially for us working at the bedside, at the front line. And COVID-19 was definitely a life changer for all of us. And for PNAA, a lot of our members were in the front lines against novel coronavirus. And sadly, we lost some of them in this battle. And the PNAA has created a COVID-19 task force, which is headed by our esteemed president, Dr. Mary Joy Garcia Dia, who's from PNA New York. And along with our other excellent leaders, our regional vice presidents and other committee members. And we started the Heal the Campaign Nurses, which was initiated along with a fundraiser to support the critical and immediate and long-term interventions that will benefit the nurses and the community. We have, the first thing that we did was additional opportunities were started via Zoom, and it was all about public health awareness, 19, and we also have had a lot of and most of our workshops recently has been about resilience, wellness, and just the well-being of the nurse. And there has been a lot more for PNA. And also recently we...
Virginia, is there anything you want to add?
At the local level, PNA Maryland, our group has been doing Zumba. We figured out we've got to do some physical, and then we have a group of nurses who would, they do this weekly. They go out to the public parks and they do the walking, and then so which is wonderful. It's because you need to go outside after you've been, quarantined for a long time. So and the beauty of the Zoom now is because you can do a lot, So we have our president-elect for the chapter is into Zumba, so she would do this Zumba class. Somebody's birthday, and then we do the Zumba, and then so a lot of nurses then would participate in that, and that connecting, and also at the same time exercising. And we also did a lot of, we collected things for the COVID unit, because we opened a convention. So we and donated that. So as it is so yeah,
well,
so we stay active.
I love battery, because the isolation that people felt during this time was just huge, and that impacts our mental health as well. Melissa, I am going and kick.
I'm presenting a little bit, a snippet of what PNA of America is all about. It is an organization that's responsive to the Filipino American nurses' needs and a positive force in the world arena of nursing. Next slide, please. So the history of PNA started about 42 years ago. We actually are celebrating our 42nd birthday this year. It started in New Jersey with 5 chapters, which is the PNA New York, PNA New Jersey, Southern California, Illinois, and Michigan. But from that 5, we have grown to 55 as of 2020. Thousand members that we can speak of right now. And originally, we were, by the way, it was only in 1987 that we officially became the PNAA. Next slide, please. So there's a lot of, we have gotten scholarship grants from several organizations, and also we have promoted a lot of activities that unify the Filipino American nurses in the US, and collaborated with a lot of organizations and agencies in order to promote the Filipino nurses. Next slide, please. 5 chapters in the US, and it's divided into 4, and each region has. And I think most of the nurses that are watching are from Florida. So in Florida alone, there's 5 chapters. They are one of the states with a lot of PNAA chapters. So there's one in Central Florida in Orlando, one in Tampa Bay, in Miami, Southeast Florida. There's one in Gulf Coast, as well as in Northeast Florida. You can always reach out to us via the website, and you can email us if you want to join our organization. There's 55 chapters to choose from. Next slide, please. So you can join, as mentioned, via mypnaa.org. And I'm sure a lot of these new nurses or other nurses that have not joined the PNAA always has a question, what's in it for me? And I can give you top 10 reasons to join the PNAA. And it includes over $5,000 for our Facebook page. Every week, there's a contact hours or educational opportunities. And there's also tuition discounts with university partners. We have product discounts. And your membership to to PNAA can also be used as part of your clinical ladder and your career enhancement. And also, we do a lot of community outreach, like Tita Virginia had mentioned earlier. We have medical missions, and all these are priceless reasons to join. We also have the 5K marathon, and you get to connect a lot of mentors and next. And just as mentioned, to 3-day conference, and it's in Oregon right now. They're doing it virtually, and it has a lot of excellent speakers there. And just this week, we also had our bylaws forum. I mean, you can learn a lot. And another good one that's coming up or is ongoing actually is how to do a poster presentation, especially for nurses who want to venture into research and all this educational opportunities for um, for them. Next slide, please. And PNA members, of course, advocates, and a lot of this are pictures from all the different chapters all over the US. And as you can see, some chapters did they made face masks to be distributed to the local community. There's medical missions, there's food banks, there's stroke awareness, and a lot more things that we do for the community. And with the 55 chapters, everyone is so active in doing all this community outreach. And as you know, for all the new Filipino nurses, our kababayans, we are here for you. So visit mypnaa.org or also check out our PNAA Facebook page. And you can always email me. My email is on the website. When you press on that join us today, my name is in there, and you can reach out to me for if you have any questions about PNAA or just about life in America or nursing in general. And next slide, please. And we would like to cordially invite everyone that's on Facebook Live right now. Nurses Week is coming up on May 8th, the week of May 6th to 12th. And our organization, along with the foundation, is having a tribute to all our nurses. And it is free. So you just go to to Facebook and register yourself, and everyone is invited. And a lot of local Filipino celebrities have graciously and generously donated their time and talent to entertain and to at least get our minds off all this stresses that we have. So do join us on May 8th at 6 p.m. Eastern Time for a very great program, our tribute to our nurses. And that's it. That's the end of my presentation. I just needed to do a very quick synopsis of what PNAA is all about. And thank you for giving us this opportunity.
Absolutely. And with all the times I've gone over to the Philippines, I can say that Filipinos can certainly put on a show and are great entertainers. So I'm sure that'll be a great tribute. about nurses across the U.S. So that they're able to get on and register. I think it's tremendous what you're doing. It's always shocking to me how few nurses are participating in professional associations. But I think one thing I've learned about Filipinos, because there are so many Filipinos working around the world and outside of the Philippines, is they're great at coming together as a community. So I think it's wonderful that you have this resource for Filipino nurses, and there couldn't be a better time for that. Well, we're going to ask the audience if they have any questions as we get ready to wrap up. So I'm just waiting to see if any come through. We're again, to have you both on this session. You mentioned that there's 55 chapters. Avant places nurses in 42 states. So has this virtual world made it easier for people to join those chapters and get socialization if they're in more rural communities?
It's both. It has connected us really easily now because of the Zoom, but it's also a challenge because I think a lot of the Filipinos, or even not Filipinos, we always want the face-to-face. But Zoom right now has really helped us to be connected and kept connected with all our members. And we are very appreciative when they attend all our educational offerings, our webinars, and all our other events. And so far, if all the nurses that have come over, just check out our Facebook and our website, and you'll see all the good works and the excellent work that PNAA does for you and the community.
Great.
I think I would like. I would like to echo that. Yeah, I would like to echo that. It's because the PNAA is your excellent resource. Especially for new nurses. You can identify mentors in there. You can identify people who would be your support system, especially when you're new to the country. And the Filipinos are a very social community. So you get a group of them together with food. I mean, the whole, the place changes. So stay connected with your Filipino community, especially with the PNAA, because we understand what you're going through and we can help you navigate the system. Remember, every Filipino is the ambassador for the Philippines. So I always stress that, you represent the Philippines. So we want to be able to encourage you to continue to do that, and then join the PNAA, because you'll find the services and the support to be invaluable. Thank you.
Any other comments as we wrap up? We haven't gotten any questions. So anything else you'd like to add, Melissa or Virginia?
Well, we're just very thankful to everyone and to Avant for inviting us and giving us this opportunity to share our experiences, as well as showcase what Philippine Nurses Association of America is all about. We sincerely thank you, and just to all the nurses that are listening, especially the new ones, just reach out to us. We're here for you. As always, just email us or reach out to your local chapter presidents, and they're aware that there's several nurses that have arrived recently from the Philippines. And thank you again.
You're welcome. And, I know from the associations I participate in that your time is as volunteers. So thank you for what you are doing to further the support of Filipino nurses everywhere. And like I said, we'll be sending this out to our nurses and, show this to the new nurses as they come in, so that they realize they've got all kinds of support that they can access, because it really is very challenging making these transitions, and there's support for them. So that's great. Well, thank you both. We're so happy to have you on here.
Yeah.
Again, Virginia, you're a dear friend. And now I have another dear friend. It's great to be with you today, Melissa. Thank you so much for what you're doing every
Thank-
day.
Thank you.